first live daily gay evening news show, and it's 7 p.m. Wednesday, March 11th, 2020. Tonight we begin the show with Breaking Q News. We are going to discuss coronavirus, and this special that we call Coronavirus Infects the LGBT Community, a Q News Tonight special survival report. We begin tonight as we do the most comprehensive summary of the coronavirus for the LGBT community that we are aware of by announcing that at 12:36 p.m. today, the World Health Organization declared coronavirus a global pandemic. So as we begin to focus tonight, this will be part one of many recommendations that we give you about coronavirus and how it affects the LGBT community. We begin by showing you a chart that we've prepared on the death rates for flu versus coronavirus. And as you can see here in flu versus COVID-19, the death rates that are being reported are dramatically higher than the flu. COVID-19 coronavirus is a flu, but it's much more dangerous than the regular flu, especially the older you get. You can see in factors 0.83% for the flu if you're 65 plus. But the reason of the great concern for coronavirus for older Americans, older LGBT Americans, is when you follow into those same age demographics, you quadruple and even higher to 3.6%, 8%, or 14.8%. And for all other age group factors, the numbers are still significantly higher. So until we are able to pat down this flash fire that is taking place in coronavirus, we're dealing with a dangerous pandemic. So good evening again, America. It's 7 p.m. Wednesday, March 11th, 2020. It's time to queer up the news. We are literally out of the closet and into the headlines. So many of your stories that are important to you. Next on Q News Tonight.
Tonight on the world's first live daily queer evening news show.
Tonight's news about the gay community and the news from an LGBTQ perspective. Are our gay stories important to you? In headlines, politics, entertainment, gay culture, travel, religion, and more. Reported by respected anchors.
Out of the closet and into the headlines on Q News Tonight.
Well, again, America, welcome to Q News Tonight. We are live and unscripted, so anything can happen. Tonight, we bring you the news of and a perspective from the LGBT community. I am your anchor, Al Ferguson, and these are my co-anchors, Aaron Darr and Napoleon Plays. So let's cue up the news. We have breaking Q News and our special report tonight of how coronavirus has infected the LGBT community. We're going to first begin by telling you all of the breaking news related to coronavirus that you should be aware of. First, tonight at 9 p.m., the President of the United States will hold a nationwide address in the Oval Office. We believe he's going to discuss the state of emergency, including the World Health Organization's announcement today at 12:36 that coronavirus is now a worldwide pandemic. We also report in Breaking Q News tonight about the coronavirus of the first quarantine isolation in the United States. The city of New Rochelle, New York, has been quarantined. Before we tell you about that story, watch this.
We begin with the coronavirus emergency. Tonight, the first containment zone here in America, the New York governor imposing restrictions on a community just outside New York City, linked to the largest cluster of cases in the country, calling it a matter of life and death. The containment zone shutting down schools and major gathering places within a 1-mile radius in the New York suburb of New Rochelle. At the center of the zone, this synagogue, where dozens were exposed by a lawyer who remains in critical condition tonight. His wife now sharing her husband's struggle to find out that he was sick with the coronavirus. She says it took days for him to be tested after asking doctors at a hospital what was wrong with him. Tonight, across this country, there are at least 808 confirmed cases in 37 states and the District of Columbia, and 29 people have now died, 2 more just today.
Governor Andrew Cuomo of New York said today, when they do the retrospective on this one, they are going to say, why did it take the United States so long to bring up the testing capacity? That is his blame for the reason for the isolation quarantine of this American city. On Tuesday, Cuomo announced that he was implementing a containment area around a 1-mile radius in the city of New Rochelle, New York, just outside of Midtown Manhattan, home to the largest cluster of coronavirus cases in the country. Gentlemen, what do you think? First breaking news on isolation in America.
Well, I think it's frustrating because coronavirus isn't news to us. We were one of the first major LGBT networks to report coronavirus when it was occurring in China. And what we know of, I mean, it really came to fruition on January 9th. It's going well into the middle of March, and yet our government here in the United States, we still don't have a proper contingency plan. A lot of these deaths and a lot of the infections, contraction, and transmission of coronavirus around the country could have been prevented had we actually had an administration that would have laid the foundation necessary to address this very important health crisis.
You know, you're absolutely right about that. However, it is important to get that information out correctly, and that's why specials like this one are as important as they are. Yes, we've had this information for a couple of months, and it's gotten a little bit more solidified, but at least through these kinds of procedures, we can inform other people how they can stay safe and guarded and make sure that they're protecting themselves, even if our government is not as helpful as we might want it to be.
Well, let us tell you what we're doing here tonight, America. Very unique. As far as we know, the first time that any media organization is directly speaking to the LGBT community comprehensively about coronavirus. We're going to try to provide you as many facts as possible for you to prepare with what is coming. This is the first part of a 2-part emphasis on coronavirus for LGBT that we call Coronavirus Infects the LGBT Community. We're going to cover many subjects tonight in terms of health, religious, political, sexual, you name it, food. We're going to cover it here tonight.
Yes, so other breaking news stories that are going on around the country that are somewhat related to that of coronavirus. We're seeing outside of Super Tuesday politically, everything that went on last night for former Vice President Joe Biden having a wonderful night. And then, of course, Senator Sanders holding a press conference today saying that he was going to continue to move on well into the primary contest throughout the rest of this month. And a story related to coronavirus that I've heard, there was an individual, of course, they were an older couple in their 80s, and there was an individual that had reported that he actually had symptoms of the coronavirus. He was older, and he ended up dying in his house, and it was an elderly couple. So because of our unpreparedness, he's in that house with his wife, dead, for over 30 hours. His corpse is there, and his wife is there as well, until they could test him positive as a deceased person, positive for coronavirus, and he did test positive for coronavirus. And then after those 30 hours, once that test result was confirmed, his body was taken, removed from the house, and now his widow, his wife of over 50 years, is having to seek psychological treatment. So when we say that the most at-risk community here in the United States is people with compromised immune systems, people with heart and respiratory issues, and especially our seniors, we're not joking. I mean, it's very concerning for people of the age of 65.
The number one issue that must be immediately overcome is testing. Tell us about what's happening on the testing front.
So in terms of testing, a lot of this is new right now. We are seeing that there are over 1 million corona tests that are now more readily available across the country, and allegedly by the end of the week, 4 million of those are going to be available to the rest of the country, according to the White House Coronavirus Task Force.
Well, the allegedly is definitely the part we have to pay attention to, because that might not come to fruition. Vice President Pence has reported that news from the nation's largest testing labs, including Quest, are now in full test production for millions of coronavirus test readiness kits. hopefully we will see that happen so that people can at least be aware. The story you just said was heartbreaking, and hopefully we can avoid that from happening.
Also, in big reporting news on coronavirus today, the White House coronavirus briefing reports that all testing related to the coronavirus for people in the United States will be free. So no one will have to be concerned about the cost related to testing when testing becomes widespread.
Yes, and in the White House coronavirus briefing report today, they said that if you have insurance, it is going to cover this this very important test that so many Americans are going to be needing in the very foreseeable future. So all insurance providers will cover coronavirus with no copay and no hidden fees.
The White House has stated that the coronavirus, in their coronavirus briefing, that the payroll tax suspension is going through, and that the executive order will suspend employer and employee payroll taxes to fund wages lost for coronavirus.
It does have some effect on the elections, the vote yesterday in the states, including Joe Biden's big win in Michigan, in that it had political effects. Coronavirus is having political effects. Yesterday, Joe Biden and Bernie Sanders canceled their campaign celebrations that were to take place in Ohio. Joe Biden continued on to Philadelphia, and Bernie Sanders returned to his home state and Burlington, Vermont. It has been announced that Sunday's Democratic debate will have no audience or political spin rooms with the media. They announced, both campaigns, wish to follow the CDC guidelines on no gathering recommendations, meaning no large groups. Donald Trump simultaneously announced that they had scheduled a new rally this weekend with thousands of participants to take place in Wisconsin. And both President Trump and Vice President Pence have now been confirmed to be related exposure to coronavirus by other individuals, principally from CPAC conference, but have elected not to be tested.
So, and I just want to point out to our viewers, too, that Joe Biden actually was supposed to be in Tampa today, and he has canceled that as well. So I think we're going to continue to see this trend throughout the country. And outside of politics, queuing up religion. So how is coronavirus affecting religious parishes all over the country and its social effects on religion? Religious evangelicals across the country and all over the world are arguing that coronavirus is God's plague to the LGBTQ community.
That's absolutely true. Religious evangelicals argue that corona is a plague on the LGBT community from God. Fortunately, we do have some opportunities to at least help you out with that. We did just launch our new show this past Sunday, so we hope that if you are looking for that service, that at the very least you can find that every Sunday at 10:30 or thereafter to find that sense of faith.
On the Sunshine Cathedral, the largest LGBT church in the world. We report on Stephen Andrew as example to what we're talking about of the social impact of coronavirus, the head of USA Christian Church. He has now been quoted as saying, "Our safety is at stake since national disobedience of God's laws brings danger and diseases, such as the coronavirus, but obeying God brings covenant protection. God protects the USA from danger as this country repents of LGBT, false gods, abortion, and other sins."
Stephen Andrew also has gone on to declare that March is Repent of LGBT Sin Month, which this is done in a notion to protect the United States of America from diseases such as the coronavirus.
Thank goodness.
Quote, "The homo virus has infected America." Watch this.
He supports the whole homosexual movement. The last thing in the world the black community needs is more destruction of the family, more attacks on the family, and that's all this whole homosexual movement amounts to. It is a virulent, violent attack. You know what? It is the I may get in trouble for this one, but this is right off the presses. It is the homo virus for the family.
That was stated by E.W. Jackson on his radio show, and he's the Republican nominee for Lieutenant Governor of Virginia and also the 2018 U.S. Senate candidate.
Well, the coronavirus was sent by God to purge LGBTQ people was also recently stated by Rick Wiles, founder of the Christian True News. And he is an official reporter credited as an official media outlet for the White House. So coronavirus definitely has been weaponized by the evangelical community.
Yes, and out of that very sad news, moving from religion, of course, onto, but what else? Vote 2020, so politics. We're going to cue up the effects of coronavirus on politics in America. And coronavirus, unfortunately, right now is seeming to be used as a political weapon.
That's right. And as recently as reported on Fox Business, coronavirus is an impeachment scam. Their statement. We've got a video for you. Watch this.
Chorus of hate being leveled at the president is nearing a crescendo as Democrats blame him and only him for a virus that originated halfway around the world. This is yet another attempt to impeach the president. And sadly, it seems they care very little for any of the destruction they are leaving in their wake. Losses in the stock market. All this, unfortunately, just part of the political casualties for them.
So as our viewers just saw in that video from what else but Fox Business or Fox News, they're essentially weaponizing on their end the coronavirus, but saying this notion that Democrats are politicizing coronavirus, when we know that essentially that's not been true from what we've seen in tweets from the White House, as well as statements, very public statements, many of them already made by both President Trump and Vice President Pence. We've seen that they've been politicizing this and using it as a weapon in a very important election year. And speaking of which, Donald Trump actually has gone on, but what else? His Twitter. So he's tweeting about former President Barack Obama and the Ebola crisis that the United States had once previously faced, and just to prove that it's just politics. So take a look at some of these tweets that we have.
Well, it's a situation where he criticized President Obama in dealing with the Ebola crisis, and then you can see that
he can't do any better.
He can't do any better.
Well, it's interesting because, I mean, he goes on to say in 2014 that President Obama has a major meeting of the New York City Ebola outbreak with people flying in from all over the country, but he decided to play golf. Yet, literally 4 days ago, Donald Trump was here in the state of Florida attending a fundraiser for his re-election campaign while his vice president, who he's passed the buck to on this disease, meeting with healthcare providers and local elected officials here in South Florida, he's instead fundraising while people are dying.
That's where we're at in this country. Unfortunately, we do have his voice, we have other voices, and fortunately, we do have our voices. And we want to ask you, everyone watching, are LGBT voices important to you? Can the news of the world have a gay community perspective? If you, like us, think the answer is a resounding yes, then like and subscribe to Q News Tonight on YouTube and on Facebook. Do our gay cultural stories impact you, your friends, and your family? Start a watch party. Get your circle involved in our conversation, as it supports the entire gay community. We move forward in this next part of this special address on coronavirus, and we want to make sure that you can be prepared. These are some of the suggestions that we have for you. The number one suggestion, these are the recommendations from the CDC. The number one suggestion is to wash your hands and other precautions. Clean your hands. Follow normal preventive actions while at work and at home, including cleaning hands and avoiding touching your eyes, nose, mouth with unwashed hands.
In this segment of our coronavirus infects the LGBT community, we're making recommendations about washing your hands and other precautions. And number 2 recommendation is do not touch your face. Wash your hands for 20 seconds with soap and water. Use an alcohol-based hand sanitizer. I don't go anywhere without it now. And your hand sanitizer should have an alcohol content of at least 60 to 95%.
And the 60% is important to kill the virus.
Yeah, so number 3 here on additional cleaning times and necessary precautions and best policy procedures, if you will, for one to protect themselves from the coronavirus is that of just washing your hands and when to know when to wash your hands. And part of that is after someone blows one's nose or coughing or they're sneezing, after you use the restroom, before eating or preparing foods, after your contact with animals or pets, before and after providing routine care for another person who needs assistance, especially that of children or seniors.
And then number 4 is is cover your coughs and sneezes. Make sure that you use a tissue and then throw that tissue in the trash, or at the very minimum, use your elbow. The droplets that you expel from your mouth and from your nose are the #1 major source for the coronavirus spread, period. So keep that from happening.
The number 5 recommendation is to pay attention to what surfaces you are touching. It could be doorknobs, it could be your phone, it definitely could be somebody else's phone. Clean them frequently, clean your hands frequently, and the surfaces that you are touching and the objects that you touch regularly, like your keyboards at work or at home, make sure you clean them daily.
And also, just an important note for that this virus can live on surfaces for up to 6 months. So taking these necessary precautions that the CDC and that we have just recommended are very crucial to combating contraction and transmission of the coronavirus. But part of this also is social distancing. It's maintaining at least 3 feet distance at all times between yourself and anyone else. So why is this important? When someone coughs or they sneeze, they spray small liquid droplets from their nose or mouth, which may contain the coronavirus. But if you are too close, you can breathe in these droplets, including the COVID-19 virus, if the person coughing has been suffering from this disease.
And that's why number 6 is so important, is to make sure you're keeping that distance. And number 7 is to make sure that you take that the next step. Stay home when you're sick, except when you're going to get medical care. If you need to get that medical care, and we encourage it if it is necessary, then go for it.
And number 8, I know we're gay, but no touching. It's our new rule while coronavirus is infecting the LGBT community. No handshaking, no fist bumps, no hugging. You're not being rude, you're actually being loving. Make sure no touching.
So rather than a handshake, just always let it come from the heart. And number 9, so avoid children, older people, and individuals with chronic illnesses, so sick people at all times when possible. They have the highest risk factor of contracting and transmitting coronavirus.
And of course, share this information with them. And then number 10 is to call your medical provider. Do not go in person. Call in advance, and that will allow your health provider to quickly direct you to the right health facility and help organize all of what's going on across the country.
That's right. Continued recommendations is number 11. Practice healthy habits. Don't forget, don't be preoccupied just by coronavirus. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious foods.
And number 12, it might be a little bit late here, but don't panic. You have to start all of this preparedness, everything that we're talking about, and manage your anxiety in the process.
That's very true. Maintaining calmness can help your immune system. And now moving on to the next portion, we want to make sure that you know how to clean surfaces in home and at the office to make sure that you do not contract this virus.
We say first, number 1, clean surfaces that you touch. If surfaces are dirty, they should be cleaned using a detergent or soap and water prior to disinfecting them. But you want to make sure the surfaces in your home are continually kept clean, especially if you're bringing friends or family into your home for safety.
And of course, furthering this notion of cleaning and how important that is. So number 2, cleaning products with alcohol products, so at least 70% alcohol. For further disinfection, diluted household bleach solutions, alcohol solutions with at least that 70% alcohol threshold. The most common EPA-registered household disinfectants should be the most effective.
And that's number 3 coming up next. Diluted household bleach issues. Diluted household bleach solutions can be used if appropriate for the surface. Follow manufacturer's instructions for application and proper ventilation. Check to ensure the product is not past its expiration date, and never mixed household bleach with ammonia or any other cleanser to make sure you're using it effectively.
And exactly what that means is preparing a bleach mix that is foolproof on coronavirus. If you're going to create a gallon, in gallon, 1/3 of a cup, use 5 tablespoons of bleach per gallon of water you use. If you're going to use a quart, in 1 quart of water, use 4 tablespoons of bleach. The mixture, either way, in quart or gallon, will become foolproof in terms of disinfectant.
So in these surfaces, we're not just talking about hard surfaces, we're also talking about soft, porous surfaces. Yes, number 5 here. And that includes carpeted flooring, rugs and drapes. You have to remove all visible contamination if present and clean with appropriate cleaners indicated for use on these said products.
Number 6, these are the items to clean. Make sure that you cover it. Clean and disinfect all doorknobs, switches, handles, computers, telephones, bedside tables, bathroom sinks, toilets, counters, toys, and other surfaces that are commonly touched or that are on home or around the workplace to make sure that you're disinfecting those common areas that you might not think of.
Something I've lived by for the last 20 years on cruise ships. Number 7, use a tissue or your knuckle to touch. To the extent possible, avoid touching commonly used surfaces in public places like elevator buttons, door handles, handrails, etc. Use a sleeve or a tissue or the knuckle of the back of your finger instead of your finger or your hand.
So number 6 here, we have just general preparation. It's the coronavirus emergency preparedness checklist. So number 1, have a 30-day plan. Have a 30-day emergency plan on a 30-day supply of non-perishable food items. Most important here, especially for our seniors and people with compromised immune systems, your prescription medications. And have other health supplies on hand and at the ready, including pain relievers, stomach remedies, cough and cold medicines, fluids with electrolytes and vitamins, laundry detergent, and other household items.
And then number 2, in how we can help you prepare and this checklist to make sure that you are prepared so you don't have to panic. Have non-perishable food recommendations. That means 30 days of non-perishable foods like rice, beans, peanut butter, crackers, snacks, canned foods, all those things. Schools might close. What happens if schools close? Your office or neighborhood is quarantined. Make sure you're prepared.
Our next segment in Coronavirus Infects the LGBT Community is a vitally important subject, probably the #1 medical issue in our community, and that is HIV. And what is the HIV risk and coronavirus? We want to first report that Dr. Sarah Henn, the Chief Medical Officer at Washington's Whitman Walker Health Hospital, says, quote, "The risk of people with HIV who are receiving standard of care treatment to control their HIV is not significantly greater than the general public contracting or becoming seriously ill from the coronavirus." Now, what this means is if your HIV is manageable, especially if you're undetectable, you have no greater risk having HIV in contracting or the consequences of coronavirus than the standard population counterpart.
Yes, and further to this notion, Dr. Henn has also gone on to state that I think for someone who has a relatively normal CD4 count, so those very important white blood cells, but is HIV positive and their HIV is well controlled and their viral load is thus undetectable, I don't foresee them as being significantly greater at risk for coronavirus.
However, there is the exception, and that's HIV over 50 years of age. One thing, this is a quotation, one thing we should think about is more than one half of our patients living with HIV in the districts that are over the age of 50. So that in and of itself puts them at an increased risk.
I think this is very important because many in our community are very concerned about HIV and its interaction with coronavirus. The reporting so far, and studies are going to continue, is that you are not at greater risk except the age factor if you have HIV and your HIV is managed and maintained. Continue to do that.
Yes. And as always, Q News Tonight is going to continue to cover this and yet again another special that we'll have on coronavirus. But Q News Tonight is part of the Happening Out television network. As many of you know, we are the Daily News. But you can also watch the best of entertainment live every Monday night at 8 p.m. on happening.fun. We're also part of the most popular live gay TV show in the entire world, which airs every Wednesday night at 8 p.m. on It's Happening Out. Yes, tonight is Wednesday night, and it's almost 8 p.m. It's a talk show for some of those of you who haven't seen it. It's kind of like The View, but with a whole lot of gay people.
Our next segment that we want to talk about on coronavirus infecting the LGBT community and announcing WHO's announcement that it is a worldwide pandemic at 12:36 today is talking about anxiety, rumor, and misinformation. Our disinformation in chief, which is President Trump, continues to elude factual information. Watch this.
I think the 3.4% is really a false number. Now, this is just my hunch. Personally, I would say the number is way under 1%.
You know, this came as a surprise to all of us. It just happened. It shows what can happen in life.
Oh, we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work.
The Obama administration made a decision on testing, and that turned out to be very detrimental. It's going to disappear. One day, it's like a miracle. It will disappear.
Well, clearly, we know in the LGBT community, anxiety and fear is now beginning to run rampant, and here is seat one where it is caused. Ignorance, politics, stupidity, whatever it is that you want to call it, we do not care. It is misinformation, and one of the reasons why we're doing this special here at Q News tonight. One thing that I remind myself is the mistakes that we are watching our government do will likely come back to haunt him because he is not going to be able to tweet his way out in misdirection from coronavirus. There is dramatic issues with this, and The Guardian, as we're putting this quote up, talks specifically about how misinformation in coronavirus in America is going to affect the democracy itself, and we're showing that to you in a moment. Next, we want to move on to a segment about masks. There's a lot of misinformation here. Aaron, tell us about recommendations on masks.
So yes, we do have some recommendations here on masks and the anxiety and fear that can happen from the misinformation that we're seeing from the White House. So masks are really not that effective. For healthy people, wearing a mask is not likely to make that much of a difference in protecting them from the virus. It's less likely there is something in the air that you're going to breathe in. It's much more likely if it's something you're going to touch and then touch on your own face or mouth. And this is coming from Dr. Hen. Making this statement as well. She, of course, is the Chief Medical Officer at Washington's Whitman Walker Health.
Now, if you are considering having a mask, we want to ask you these questions. Number one, statements. If you are healthy, you only need to wear a mask if you're taking care of a person with a suspected 2019 nCoV infection, meaning the coronavirus. Two, wear a mask if you are coughing or sneezing without question. Number three, masks are effective only when used in combination with frequent hand washing, as well as alcohol-based hand rub or soap and water, so keeping your hands clean. And then number four, before putting on a mask, clean your hands with alcohol-based hand rub or soap and water to make sure that your hands are disinfected before touching your face.
Continued recommendation on mask is to cover your mouth and nose with a mask and make sure that there are no gaps between your face and the mask itself. Number six, avoid touching the mask while using it. If you do, clean your hands with an alcohol-based hand rub or soap and water. Number seven, replace the mask with a new one as soon as it is damp and never reuse the mask again. We want to point out that tomorrow night we are going to, as we talk about the politics of the White House, hashtag walk away with Joy Villa. We have a special tomorrow night, Thursday, March 12th at 8 p.m. And she is going to talk about what's happening in the LGBT community for the Republican Party. We are also telling you that tonight we are broadcasting from our studio set in the middle of the World AIDS Museum and Education Center in Wilton Manors and Fort Lauderdale, Florida. We joke we're coming from the gayest place on planet Earth, and we thank our set designer, Concepto Modern Living, here in Fort Lauderdale. That is a summary of part one of coronavirus infects the LGBT community. We are going to continue tomorrow with part two and get into very specific details and recommendations from the best advice in America and around the world. And tomorrow night we're going to talk specifically in our part two on coronavirus about what you should do in your workplace and what you should ask your employer to do, what the ramifications and your choices should be in gay nightlife, including events, prides and attendance of prides, going to gay bars, in the evening, etc. We're going to report on restaurants, how you can eat out safely, and especially questions that relate to items in the restaurant and salad bars. We're going to talk about gay travel. Is that incredible deal that you're seeing right now really worth the deal? We're going to talk about grocery shopping. You might not realize it yet, but are you going into a grocery store and are you going to produce where other people might have touched the fresh produce? And of course, we're going to talk about the gay gym. What do you do in terms of going into the gym? And finally, we're going to do a segment and show and tell you about all of the myths going on coronavirus. We want to do the exact opposite of President Trump and myth bunk, and create a segment called Not Fake News on coronavirus. So this has been part one of Coronavirus Infects America. Today, we are in a situation where we have a worldwide pandemic declared by the World Health Organization, and we are going to provide as much good information as possible to help you overcome anxiety and fear in the LGBTQ plus community. A lot of letters. I thank my anchor partners, Aaron Darr and Napoleon Plays. That is today's news for the LGBT community on the world's first daily gay evening news show. Remember, if it is important to you and the LGBT community, it's important to Q News tonight. We are, again, literally out of the closet and into the headlines. And this is Q News Tonight. Thank you. And we'll see you tomorrow at 7 p.m. for part two of Coronavirus. Good night.